I tell you, say I go make a move. I tell you, now you know they believe. No be treacherous me. Kwa kwa kwa, kwa kwa kwa, kwa kwa kwa. Yeah, nyami ashura mi o. Nyami ashura mi apra mi o. Ah, nyongo ajobie, ajobie. I'm blessed. Oluwa ti bùn kún mi. 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 He bless me, nyafu. Come on. I tell you, say I go make a move. I tell you, now you know they believe. No be treacherous me. Kwa kwa kwa, kwa kwa kwa, kwa kwa kwa. Yeah, nyami ashura mi o. Nyami ashura mi apra mi o. Ah, nyongo ajobie, ajobie. I'm blessed. Oluwa ti bùn kún mi. 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 Sa?
Hello.
Hello, good evening.
Good evening. Dr. Faisal.
Yeah.
This is Afia Prinscilla.
Okay, Fia, how are you?
I'm okay.
Yeah, glad to be on the show.
Yes. You disconnect me. Brown line. Anyway. Hi, Princess. Hello.
Hello, yes, I can hear you clearly.
Oh, okay.
Can you see me?
Yes, please. I can see you.
Okay, good.
Okay, so we are live now on the Pinky Room Show.
I'm trying to use my other phone so that I put this one off.
So welcome to the Pinky Room Show. Sorry for the delay.
Oh.
Miss Afia, can you put your name on the screen for us, please?
Okay, my name
on the screen for us, because I think we've got Princess Roy as well. Okay, so welcome to the Pinky Room Show. Sorry for the delay, guys. We had a little bit of technical issues, but we are live now. You know how it is.
Yes.
It's technology. Anything can happen. But I'm so happy. I've got my wonderful people here. I've got my special guest. I've got Dr. Faisal. You have to introduce yourself for us.
Anyway, good.
For us, I've got so many people already tuned in. Thank you so much for your time. Wow, this is amazing. I've got people already sending their comments and everything. I will take my time to read all your comments. Please keep them coming. I've got my senior medical doctor here. He's got all your answers for you. Today we're talking about depression. So this is something that is going on. People are suffering, but some people are not even aware that they're depressed. And I have my lady here. I have Miss Afia. She is a gospel musician from Ghana. She's also with us. We can't see your face well. I don't know if we can put the lights on in your room, Miss Afia. Yes, better. I think we're getting you better now. So we have that's better. So we have Miss Afia. Sorry, the name there she put Princess Roy. Well, Yes, it's Miss Afia Prinscilla. She's a gospel musician in Ghana, and she's joining us today as well. We've got a lot of stories to share. We've got more educative time, to spend with you. So let's first we have our segment that we do every on the show. So the first segment is a funny segment that we do every episode. This is the June episode, and our funny segment. I'm going to throw this to our doctor. I don't know
Yeah.
when I heard this, it was so funny that I don't know. But to be honest,
Yeah.
I thought, you know what, this is not funny, right? But then I'm going to put it to my guests to tell me what they think. So this is
Okay.
what I heard from a lady. She said, "Princess, I want to divorce my husband because he fats too much." And I thought, okay, this is so funny. So we're going to use this as our funny segment. So I want Doctor to tell us about, is it good for a lady to divorce the husband because he fasts too much?
Oh wow. This is a rather interesting reason
That's
for
it.
divorce. Yeah, but yeah, to start with, you would want a few more facts. Um, First of all, you want to know how recently this has started, if it's an old problem or if it's a new one.
Yes.
And then I would say that she should hold on. There's very likely a solution to this, and then she wouldn't have to divorce him.
Divorce. Maybe she's suffering, Maybe she's suffering. She maybe let's tell her what's the benefit of that. Maybe she doesn't know why the husband is doing that. But what's the benefit of someone fluctuating, like fatting? Is it a bad thing? Is it to me? I thought this is part of human life. It's a lifestyle. It's part of human lifestyle that we have to do. So if we
Yeah,
don't fast, what's going to happen to us, doctor?
yeah. To be honest, it's very important to be able to release gas from the gastrointestinal system. As you
Yes.
can see, well, good evening to our viewers, definitely. But as you can see, I just came back from the hospital.
All
I'm
right.
still in my way. I haven't changed. And one of
Oh,
the things you would realize in the surgical ward,
Welcome.
yeah, thank you. On the surgical ward, if you have a patient who has had surgery on the bowel or on the intestines, you would literally be waiting until the person farts before you can go home, because the person farting would indicate to
Wow.
you that surgery was successful.
good.
So
Right.
it's important.
It's important.
It's very
At
important
first I
to
was
do what you have
laughing.
to do.
I was
Yeah.
laughing at it, but when I thought about it, because I'm a health professional as well, and
Oh,
when I
love.
got at that point, I was like, okay, hold on a minute, because this shouldn't be a big deal because he has to do it. Maybe he's not doing it at the right time or at the
Yes.
right place. Or what
Yes.
do
So,
you think?
so in this scenario, of course, as they would say,
Yeah.
the good and bad sides of everything. If there is reason to believe that it's excessive or it's as a result, it's beginning to cause problems, then it can also be investigated. Maybe he has had a change of diet,
Yeah.
or he has had a change of a certain part of his routine
Mm-hmm.
that is causing him to behave that way. So we have to investigate further.
Investigate further. Thank you.
Yeah.
And if you're watching, you've heard the doctor itself. It's very important for human beings to fast. So it's part of it. It's funny, but honestly, it's part of our life. It's a lifestyle. It's part of what God created human beings to do. So doctors is saying that don't you divorce your husband because he fasts too much. Find a way. We can find a way to help him. Okay. So going on to our next segment, which is what is going on segment, right? In this segment, we talk about issues that are going on that is mind blowing, things that is worrying, that we'll
Yeah.
find a way that how can we deal with this. And
Okay.
today I have Miss Effie. I think we've lost her, but we will get her on the show. She spoke to me. She said something to me when we met, and I think I saw it on the platform, right?
Okay.
Picture of her, and but I didn't know that she was the one. I didn't recognize that she was the one until we started chatting and she sent the video. She said, "This is me." So she was involved in accident, right, in Ghana,
Yeah.
right? And
Yeah.
I thought, you know what? Let me bring that one. What is going on? Is it our government that is not? Is it the road, or is it we the people, the Ghanaian people or African people that we're not going according? We're not following the rules, the regulations, the road. I mean, whatever they do. Or is it the government? What is going on? Because we see accidents in Ghana or in Africa, and it's scary. It is very scary. So how can we go about this?
Yeah.
So Miss Priscilla, do you want to share a little bit of what's it?
Yeah, I think
Yeah, yeah,
they should try and fix our roads for us.
okay,
Yeah, they should try and fix our roads for us.
yeah,
Yeah.
yeah,
And they should reduce the overspeeding because overspeeding kills. The drivers here in Ghana, when they are driving, some of them, sorry, I don't think they don't look at their lefts, they don't look at their rights, they just drive.
yeah,
My own was very terrible, you know that. An articulator crossed us. So we didn't know what to do than to throw ourselves in the bush.
wow,
And it ended up like this.
wow. So that's what I'm saying. Is it the government or is it the drivers who
So
are not following the road measures? Because there's some measures there. I wouldn't deny the fact that we have.
the government is part. The government is part, Princess.
Okay,
The government is part, Princess. They should try and fix the roads for us.
yes. What do you have to say about this,
And some
Doctor?
of the drivers too.
Yes.
Yes.
Reduce speeding.
Mm,
Exactly. Usually, in order to, from a medical standpoint or from
yeah,
the way we approach problems, is first of all, you want to diagnose what the problem is.
that's it. Yeah,
And then you want to know what factors sort of feed into the problem or cause the problem to be as pronounced as it is.
that's it.
And from my analysis, I've had the privilege, I actually hold a position in the Ghana Police Service.
Yes.
I'm a deputy superintendent of the police service. I'm actually just in the UK because I'm here to specialize in dermatology. And so I do belong to the police service.
Wow.
And so, if you want to carefully dissect this problem, you would understand that it's a multifaceted problem. First of all, we don't have the sort of roads that are extremely motorable. That's the first problem. The second problem, the expertise in driving is a problem. I mean, when I got to the UK and I saw how some aspects of driving are done here, I was actually very amazed. Getting a UK driving license is close to getting a master's degree. It's
I
a
know.
whole
I know.
process on its
I
own.
know.
So you don't
Yes.
have a lot of honking on the roads, you have smooth movement and all of that. And the third problem is the nature of the cars we use. I mean, if you're not a stranger to Ghana, just one trip to Makola, you see some of the old structures that we have with poor suspension, and you just marvel. And that has put Ghana on an unfavorable list of countries that are actually very accident prone.
Yeah.
And so, to dissect this problem properly, you have to look at all the facets. First
That's
of
it.
all, the government roads. Secondly, the cars, and then three, the drivers themselves. Yeah, so that's how I would approach it surgically.
Yeah. Coming
Yeah,
from the medical doctor point of view,
exactly.
which is very true. Like you said, in this country, to get your driving license is like, you have to do your master's degree, and it's true. You can't just get your license just like that.
It's
I
very,
failed. I have to be honest. I failed several times. I passed my theory, but it took
yeah,
me about 2 or 3 times for me to pass my practical.
exactly.
So when you get the license, you are careful because if you lose it, you can lose it, and you have to go through all the process again for you to gain your license back.
Exactly.
So you have to be careful. And
Yeah,
the measures too. They have the measures here that if like they have all these road measures and safeties that they produce and everything coming from the government point of view, whereby they'll put all these what do you call it, traffic lights and stuff and all that. How many traffic lights we see in Ghana or Africa, you know? And how many people do understand all these road measures?
exactly. And Princess, if I may cut in once more, I've come to notice that people are essentially the same everywhere in the world. What makes one society different from another society is systems.
Yes.
Systems, measures that are put in place. So
Right.
why is it that Kweku Boateng, when he lives in Ghana, he thinks it's cool to drive on the road and use his horn and be making noise and all of that. But the same Kweku Boateng driving in England does not do
Okay.
that.
All
Kweku
right.
Boateng in Ghana throws rubbish on the road
Yeah.
without looking for the nearest bin. But Kweku Boateng, the same person in England, will not do that. You see,
Honestly, this
so
is very deep. This is very, very deep.
yeah. So
I'm really thinking deep about this.
yeah,
It's strange how human beings behave in a different, environments.
exactly.
Wow.
When you know the system work, yeah.
Wow. Okay. So we're learning a lot. Thank you guys so much for tuning into the Pinky Room Show with Princess Roy. I've got my wonderful, and my special guest with me today. We've got Dr. Faisal and we've got Afia Prinscilla. She is a Ghanaian gospel musician. She's rising so fast. She will tell us more about herself. Like I said, we started beginning. We're talking about why do some women go through depression. We're talking about depression today. But before then, I want Effia to tell us about. She said, I have been through this before. I have been through depression before. I have been there before. But I'll throw my question because when I was going through that
About
process,
myself,
that's it. Yeah, you tell us about yourself, and then have you been through depression before, and how did you find out that you were depressed?
I started behaving awkward.
Yeah,
I started noticing some changes in my life. That was when I was married.
yeah. Okay, I think we're having technical
Yeah, I was
issues.
married by yeah, like I had depression, but I wasn't able to tell my parents. I wasn't able to tell my mother, my sisters, my brothers because I felt they wouldn't like the man.
Okay.
So I kept everything for myself.
Right.
Yeah. So
But
until
did you?
I saw things were not as easy as I was thinking, I had to tell them. So I had to tell my mom. So I told my mom. I told her everything. I told her every truth. I didn't lie. I told her everything. I wanted her to know what I was going through.
Through? Yeah.
And I easily get upset. I easily get upset.
Okay. Right.
Yeah. But when I left the man's house,
Mm-hmm.
that was almost three years ago. Like I don't easily get upset anymore. I was
Yeah.
okay. Unless maybe he calls me on phone, then
Yeah.
you see that my mood swing. I get the feeling that why is he calling me? I just change my mood. I'll
Right.
easily get upset again. So depression is a good thing. Yeah.
Yeah.
It's not a
Right.
good thing for a young girl like me.
To go through.
Yeah.
Yeah. So let's get back to Dr. Faisal. Okay. So in the first place, because I don't know, but we'll come back to Efia to find out how at what stage did you realize that you are going through depression. But before then, what is depression itself, doctor? What is depression? So people that are watching today might not know what understand what it is, the symptoms, the signs, what is depression and how can one know? Or what is the signs and symptoms of depression? Please.
Yeah, yes, it's a very good question you've asked, and I'm actually very happy to be part of such a platform to discuss this issue. Depression, I mean, medically, is defined as a persistently low mood.
Yeah.
Primarily, you need a person to be in a low mood. You need a set of symptoms that signify that the person is in a low mood, but these symptoms would usually stay on for a period of about 6 weeks to 3 months.
Right.
Then we say it's a major depressive disorder. The thing about depression, it's a bit complex because this has to do with the human psyche. As a doctor, let's say if you were to treat a patient with malaria, malaria is caused by a mosquito bite, and so you know the cause, so you know how to treat it. But
Treat.
when
Yeah.
it comes to things like depression that have to do with the
Yeah.
mind, the way the mind works, then it's a little more cryptic and it's a little more complex. But in terms of definition,
Yeah.
it's, if I could say it in tree, Obi and Rahu. Say, I hope my tree is even correct. You are sad all the time. You don't enjoy the things that make you
Yeah.
happy anymore, and you are in a very low
Yeah.
mood that lasts for a long time. The length of time is important because obviously you can be sad for one day. Maybe you support Kotoko or Hearts of Oak and Delu. You are sad for one day. That is not depression. As our sister described, took a period of time and then she realized that she was depressed. And that's one of the things about depression is that you may be able to recognize that, wow, one kasa would say, Charlie, I'm depressed. You can tell. But sometimes too you cannot. It takes other people to tell you that you are depressed. Yeah, so that's it in a summary, in a nutshell.
Yes, because like you're saying, I was going through some moments,
Yeah.
sometimes in my life, right? But then I did not know what was wrong with me. I found myself that anytime I just want to sleep. I don't feel like eating. I just want to be alone. And it went on for some time. And until a friend of mine, and funny enough, like I said, I'm a health professional as well, a qualified nurse. And I had no clue what I was going through until a friend mentioned that, you know what, when we were having a chat, and she said, oh, I was, the doctor said I was depressed and was this, and I was, always want to be alone. And then I went back to myself. I was like, so is that what I was going through? Because I thought it was normal because I'm a quiet person. From you seeing me on the show talking loud, I'm that kind of person who wants to be myself. So I thought it's normal. So then I realized that, okay, someone might be depressed, but not even know that person is depressed until it gets to the latter part whereby it's getting offhand, and then it becomes worse. So we need to really get that. So doctor, what's some of the signs and symptoms of the depression?
I'm very happy you mentioned that it's possible for someone to be depressed and not even know it by themselves. Sometimes it takes your neighbor, it takes your workmate, it takes someone to tell you.
Yeah.
The danger with that type of depression is suicidal tendencies.
Wow.
We've all seen on television, and you see these actors from Hollywood. You know Robin Williams there. He's a comedic character, and he killed himself. Everybody said this guy was so happy, but then deep down he was depressed. And with that said, you need to look at a few symptoms. The thing about depression is, as I mentioned, there's no blood test that when you do, you say, okay, I've checked your blood test and I can see you are depressed. No, it's a clinical diagnosis.
Yeah.
That is why in the Ghanaian society, we just think that maybe it's a spiritual problem because you see this young lady, beautiful or handsome. Why? Why are you so sad? And why are you sad to the point that you don't want to do anything? People around you just don't get it. And so the thing about depression is there's often a trigger. There is a trigger. You don't just sit down and then all of a sudden get depressed. There's often a trigger. Is it your husband that is abusing you? Is it your boyfriend that's abusing you? Is it that you've lost a family member? Have you lost your mom or your dad? Is it that you have recently gotten pregnant? That can also be a trigger.
Yeah.
Is it that you have recently failed an exam? Or has someone recently told you that you have a very big head? Or has someone insulted you recently? There's always a trigger.
Right.
Or maybe start conversation. There's always something that brings it up.
Yeah.
And guess what? Here is the interesting part. It doesn't have a particular cause. It varies from one person to another. The symptoms vary from one person to another. So in our sister's case, for example, she became sad. The things that made her happy, she wasn't happy to do them anymore. We didn't have all the details, but it sounds very much to me that she was in a difficult marriage and probably she was with a partner who may have been verbally abusing her. I say verbal because, people think that physical abuse is bad, but verbal abuse causes emotional wounds.
Yeah. And to
exactly.
Be very deadly than even physical abuse.
Exactly, because imagine you come home from work one day, you go to the salon and spend 10 hours, and your husband says, If you're tripping now, why you say who and you fit?
Imagine. And you know, I've been to that. I
You
have
go
been
and take it off.
to before.
Exactly. So then you know how words can be so damaging. But then and some people the depression even doesn't make them that sad. It may appear in the form of
Yeah.
poor appetite. They are not particularly sad, but they have poor appetite. They are not
Yes.
particularly sad, but then they have a low libido in bed.
Yes.
Things of that nature also. But then what we tend to see predominantly is the low mood. You are not happy with life. The whole world is a sad place and you are crying and you don't sleep well. Or you sleep too much.
Yeah.
This is very tricky. And most of the time you have just psychological symptoms. You don't see things, you don't hear voices. But some people get so depressed that they get to the point where their mom who died 2 weeks ago is talking to them. They can hear it. And then
Okay.
they can see their mom. Then at that point, it becomes a form of depression that is severe.
Yes.
So the symptoms are very variable.
Yeah.
But what we tend to see is that someone who is generally not happy.
Yes.
Yeah.
Mentioning that, I remember one of my patients.
Yes.
She more older at an older age, and she started talking about the mom who is dead long time ago, and I was like, "What is she talking about?" Saying, "I've missed my mom. I've seen my mom." I'm just like, "Really?" So you mentioning this, tell me that okay, so this is what she was going through,
Yes.
and then you mentioned about pregnancy. I think
Yes.
mine was more like how do we call it? Post antenatal depression, which is
Yes.
very, 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 we have to talk about that because sometimes our men don't understand why we change immediately after we have kids. Or maybe somebody is going through post antenatal depression. So the man has to understand why the woman is going through what they're going through to be able to handle them well. But then before then, I want us to speak to Afia. Afia, at what point of your life when you go into the depression that you realize that I'm going through depression now? Because some people will take long for them to figure out that oh,
Yeah. When I got pregnant the second time, that was my second baby.
right, right,
I started noticing it. Yeah, I started noticing everything. Yeah, my second pregnancy, I started noticing everything, and I didn't even feel like going to work, as in working, going to work, even though they will pay me every month, but I didn't have love to work. I even had to close my shop to, like, I was just, I don't know. Hmm. I really went through depression. I was so depressed because I didn't know what to do at that time because I wasn't all that young, but then I would say I was young by then because my second child will be 5 years this August. So you can imagine young girl who is married, going through a whole lot of things. I didn't know who to talk to because I remember on my engagement day, they advised us not to say whatever that goes through in our marriage to friends and families.
right.
So I didn't, yeah, I didn't want to tell my mom until I got pregnant with my second daughter, Shamita, and then I thought I should now let the truth come out. So I told one of my big brothers, and he was pissed off. He was very pissed off. He even confronted my ex-husband. He spoke to him, but we didn't tell my mother. And God being so good, I came out from it because it's not a good thing to go through.
Yeah, true. True. So talking about family and marriage and all that, because we want to link this to relationship and then all the other stuff that will bring out. But talking about family and all this, like you're going through something, they'll tell you when you're married, that's it. You don't have to complain, you don't have to say anything. Everything stays in the marriage. And like example, what Priscilla went through, right? Some women have been through and they couldn't come out. The last resort was we them carrying her corpse.
Exactly.
and marrying her, leaving her kids. So, doctor, in this point, what do you want to tell to the family that we have to support us, but telling us, you know what, live in that family. I mean, don't complain about anything. Marriage is this, marriage is that. So that's it.
Okay. Yeah, a few things that come to mind. First of all, the fact that if you've been, if well, I wouldn't say even if you've been in medicine, but if you've been a human being generally,
Yeah,
you should understand that women generally are more emotional than men,
that's it.
because you have a woman who has to undergo PMS, premenstrual syndrome. It makes her
That's it.
sad. Right from primary school,
Yeah.
you have friends you joke with every day, and then sometimes you joke with her, she's upset, she's angry with you. So
Yeah.
you should understand a woman by her very makeup has hormonal, biologically is more hormonal than men.
That's it.
That's the first
Mm.
thing. The second thing has to do with the institution of marriage.
That's it.
I'm not married, but
Yeah.
I have been able to, advise lots of people in my consulting room. And I've noticed that the biggest strength of any marriage has to do with the ability to resolve conflicts.
Sure.
And the biggest strength
Mm-hmm.
of any marriage has to do with the ability of the man to see his wife as his first daughter and the woman to see the husband as her first son.
Okay.
Because very much what she's saying has a lot to do with whatever went on or transpired in the marriage that may have had a very deleterious effect on her self esteem.
Yeah.
And this is a very common problem.
That's it.
You have a husband who comes home and if you how many times, I'm sorry I'm using your name, okay, Ajua, let's use Ajua. Ajua, how many times have I told you this? How many times have I told you? How many times and blah blah blah. And you did this and that, blah blah, and this and that. And another
So,
thing
doctor,
that and
doctor, use my name. Use my name.
which is very harmful.
Yeah.
And another thing that a lot of men do today, I'm actually more on the side of women because
Thank
I
you.
have
Thank
noticed
you. At
that
least we have some of them learn back to
Thank
that.
you.
because I wouldn't lie to you, everything is based on context. And
Right.
if you are a Ghanaian and you understand how Ghanaian marriages work, you know
Right.
that there's
Yeah.
so much rest on the woman's shoulders.
Sure.
First of all, if there's no children, it's the woman. If there's any problem in the marriage, it's the woman. No one blames the man.
That.
And so I'm more on the side of the women in this regard.
Thank you.
Back to what I was saying. So you have someone who is saying all these things, who is behaving this way,
Right.
and is cognitively affecting the wife and makes her have such a low mood, puts her into depression, puts her into the state of her being someone that she never figured envisaged herself to be before she got married. And another thing that men keep doing is that, oh, well, I thought you would, when I met you and we're dating, this is not, and I knew you would get married. I was sort of, let me give you an example. If you meet a lady and every day you eat at the restaurant, papaya, and you go out,
Yeah.
then you suddenly marry her and you are looking for fufu and abenkwai. You've forgotten that the lady you married was not the person preparing food.
Right.
So then expectations change.
That's it.
And that is a big problem with marriages. Expectations change. Suddenly you want to transition your girlfriend from girlfriend to wife. And so suddenly she should change. But you've never discussed things. And all of these also lead to situations whereby the women get depressed because the men ultimately lash out all sorts of terrible things to the women. We don't have the details. It could be physical, it could be verbal. I have doctor friends, or I've had doctor friends in Ghana, in Europe. They come to work and you see a slap mark here, and she's been abused by the husband. And you even see a few people who are full of confidence. They are not physically abused by their husbands, but the things that they hear at home
Right.
certainly push them into depression. And the last thing to say is the Ghanaian concept that says that when you go into marriage, whatever happens stays there. It's a big
Yeah.
problem.
It is.
It's a big problem. Lots of marriages,
When they are you.
yeah, a lot of marriages there's help is needed.
True.
Help
Yeah.
is because
Very much.
people would even say, I think there's a proverb in Trinidad that says, "Won't worry, will be I won't name the subai."
Yes.
So when you see people sitting down, boyfriend, girlfriend, everything is well, and they get married, they may have problems. And the problems can range from to fats to very simple things, and also go to very difficult things as well.
Right. True.
And so that concept that we have, that they shouldn't have discussion, all of that is also very bad for marriages,
True.
and
Bad.
tips people into depression.
Yeah.
Yeah. Okay.
And so yeah,
You
that's how it
said
is.
something. What do you want to add to what Doctor said? Concerning
Me?
the family, yes. Yeah. Concerning the family that
Oh, by God's grace, Princess, I'm no more depressed. By God's grace, I'm okay.
right. Thank God for
By
that.
God's grace, I've moved on. I've moved on. I've moved on. I and my kids, we've moved on. We are okay.
Right. That's good. That's good. I want to hit on this. Like you said, some of them will tell you this, like you go to the salon, you dress up, you do your hair nicely, you expect your husband to tell you, to compliment you, tell you that, hey, you look beautiful, and then he tells you what kind of hair. I have gone through that. And thank God that I'm the kind of woman who I have so much, my self-esteem is maybe shoot in the sky high, because that's how God made me. And then there are so many women who have lost themselves because of this kind of words. They used to be very beautiful, and then they lose it, and then the man will be like, "My wife wasn't this." Maybe because of that can contribute to being overweight. Like some people eat when they're depressed, and then she loses it. And okay, you weren't like this, and the man will start chasing young girls, side chicks, and all that, which is very very sad. So
Yeah.
men are watching me. I've seen my men commenting me. I've seen your comments. I hope you're listening. Either you're married or not, make note of this, please. You can contribute to your wife's depression, and don't be the reason why your wife is depressed, because it's bad. It's going to affect her and affect your children. And if the woman is not happy at home,
Princess,
you are going to be hate. Hello, Priscilla.
Princess.
Yes, darling.
Yes, Princess. Right. Do you know that some actions also kills actions?
Sure, sure. Mm.
There are some men who wouldn't talk. They won't say it with their mouths, but then their actions destroys you. Their actions,
The silent treatment, isn't it?
actions speak louder than words. Yeah.
Yes, silent treatment, right? Very true. Which is it can like
Yeah.
ignoring you, being rejected. People that go through
Yeah.
some people can go through depression because of
Yeah.
being rejected, and not feeling part of the family, not feeling part of people can cause that, and that will be make them to be what do you want? They use this word, being isolated, isn't it,
Yeah.
Doctor?
Yeah, very much.
Yes,
Yes. I
right.
remember my very early days of practice.
Mhm.
I ran into a case of a woman who was rushed into the hospital because she had taken 10 tablets of diazepam. And the main reason was that the man was giving her silent treatment, and that had gone on for a week.
Mhm.
And that is one of the worst things to do, because when you start to do the silence treatment, by very nature of relationships and marriage, if I'm sorry, or if there's anything that we really need to discuss, the silent treatment doesn't, first of all, doesn't solve the problem. And secondly, causes a form of rejection. People have spoken of depression and rejection as being likened to physical pain. Sometimes you feel so rejected that it's as if someone has beaten you,
Yeah.
because the receptors of the brain that process emotional pain are the same receptors that sort of interpret physical pain as well.
Right. Yeah.
Exactly. And even people give an example like, if you go out and ride a bike and you have a sore on your leg,
Yeah.
we dress that with plaster and it will heal. But when someone has an emotional wound, how do we take care of that? You
True.
know? And so yes, we that is really not the best thing to do. I've seen it so many times. They come in and all of that just because what do you call it? These things have been happening. And another thing too we have in our Ghanaian societies, we think these things are so far away from us. Whenever you go to a divorce court and you see the man standing on one side and the woman standing on the other, and they are trading insults, just remember that they did fall in love and they get married. They got
That's
married.
it. That's
And
it.
so emotions can easily transfer from one form to another, because energy is neither created nor lost. So the energy you used to love can turn into the energy you used to hate.
Wow. Which
Yeah,
is very,
which
it's
is very
sad.
risky.
It is, and very sad that
Very sad
someone
as
that
well.
you love so much, and then at the end of the day, you guys become like your worst enemies. It's, I don't know how it happens, but well, it happens. And like you mentioned before, like people go through depression, and in our African culture, they see them as either witchcraft or mentally ill, and then they deny them or reject them. What do you say about this? About
It,
people who are going through depression, they being treated as if they are, you know, out of their mind, or maybe they've lost it.
to be honest, well, Princess, it's very interesting. The way I'm beginning to have a different worldview of all these things. And
Yes.
first of all, what you have said is very true. It's very interesting that in Ghana, when you are depressed and you're not happy or there's something to discuss, they say keep it within the marriage. But then in the Western world, there's all sorts of freedoms for you to express yourself.
That's it.
And that's, yeah, exactly. And that's, people would even say it's excessive and all of that. But it's a big problem. And also, of course, we are all religious. We're all brought up to know God, to understand how God works. We're all still very religious. You go to hospital, you pray to God, and then
Good.
you know that He will help you. But on the other hand, the spiritualization of disease is also a big problem.
It is.
Not just with depression. I even remember when people are having seizures and they're
Yeah.
lying on the floor, what do? We all run away, because they said that if someone is having a seizure and you touch the person, the spirit will also come to you and you have a seizure. And so the same with depression. Depression is actually, to be honest, if you see someone who is very depressed and they tried to kill themselves last week, and then this week they tried to kill themselves, the first thing that comes to mind is no, this is a demonic
Yeah.
attack or manifestation,
Yeah.
which I don't have a problem with. But we should be able to also seek medical treatment. There are two sides to every coin.
True.
To be honest, I always say that if someone is depressed and they are not happy,
Yeah.
one of the treatments is called cognitive behavioral therapy.
That's it.
So
Yeah.
you can go to your pastor's office, you can go to your chaplain's office, you can go to your imam's office, you can go and talk to them. And the way they will talk to you will inspire you with so much hope
Yes.
that you would get better,
Yeah.
which
True.
I totally agree with. And in most cases, that happens. In most cases.
True.
But then on the other hand, if it is the severe forms and that doesn't seem to work, we should be in a position to go and see your doctor and have some tablets, further assessments, or some medications that can help, especially in moderate to severe forms.
That's
But the
it.
thing about depression is most of it is social. Most of
True.
it, if you take care of the trigger,
Yeah.
things should be okay. The only forms of depression that tend to be very severe are in the context of psychotic illnesses, like those people who have the bipolar
Yeah.
or people who go into drug abuse, substance abuse. As for them, when they are depressed, then the talk therapy will not work,
That's it.
and so they need the psychiatrist or the psychologist to take it up.
Right.
Yeah.
Yeah.
So
Right.
that's how really we should assess these things. So much as it's important to have our spiritual aspects sorted,
Yeah.
we should also have, you should go to
Physical.
hospital. The doctors are also empowered by God, nurses are empowered by God,
Right.
to help us, the patients as well.
Yes, you know, with the spiritual things, even some, it's so funny that I had a few pastors that I am very spiritual as well, and I have a ministry and stuff like that. And funny enough, this show that I was doing, sometimes when I post stuff and all that, and some pastors, the way they'll comment, I'm like, this is something that physically we need it. We need this. If we talk about relationships, look at the amount of Christians that are losing their marriages after all the prayers and fasting. And therefore, we need that education. We need that thing to help us to understand what we're going through. Because it's not all pastors who will tell the truth, right? It's not all the counseling that will tell the truth. Sometimes you don't even need a pastor to counsel you. But that pastor has no idea about what is going on. So you need someone who has been educated or been through that situation to be able to educate you or to counsel you. You know, But like you said, everything is like spiritual. Pray for me. Listen, as you watch it, this is it's not all about the doctor is saying if you need help, go for the help. There are people who have been trained as doctors, people who have been trained. God, these people are God's own people. It's not all some I know I'm like I said, I'm a health professional. I know that some doctors have their own things that they do. But listen, there are some people that were born with the gift that God gave them that gift to come and save the life of human. So there's nothing wrong. Especially those that are watching me from Africa, and we have our sister joining us from Ghana, Afia Prinscilla. If you're watching her today, listen to me. If you need the help, go for the help. Don't wait till it gets out of hand. Right, go for the help. Okay, so we've got Afia back on the show. So I have some few things that people have sent to me that okay, so we've talked about this. Someone is saying that my husband made me depressed because he started cheating on me, right? And now I am on medication. So, Effie, what do you want to say about this? About a husband, the woman wasn't depressed when she got married, before she got married, and now she's going through depression. She's on medication because the husband is cheating on her. What do you what's your take about this? I think we've lost her. We've lost Effie again. Okay, so
Yeah.
what's your take about this? Men that making women go through depression. I think we touched on that before. You know, men don't get angry at me. We know you. But
So no,
this is
I
the problem
understand.
that she sent to me, so we need to handle that. Doctor, what do you think about this?
No, it's very true. And as I said earlier on, I'm happy that we are discussing these things in the right context because we live in a very patriarchal society. We live in a society that says that, oh, if your husband cheats, oh, forgive him. You know, men are like that. But then if the woman should even try anything like that, oh, we call her all
Yes.
sorts of names. And so
Right.
it's too maybe too much of a man's world that we live in Ghana. But to back to the question, I'm saying that people get depressed to the point where they need medications. This is a common phenomenon. And there's another thing that is very philosophical in life. I mean, whenever a baby is born, there are only two fears that the baby has. One is the fear of being left alone, and the second is the fear of heights.
Right.
Being left alone, like in darkness, and I think the fear of heights. Every other thing that you are afraid of in life is because of what someone has shown you.
Right.
Someone will say, "Bibinti," and who be painting,
Mm.
because I have seen it before.
Four.
Something deja vu. That is why I behave the way I do. And so, yeah, people drive people to relationships drive women to the point where they need medications. And what these medications do is primarily alters some chemicals in your brain that release a lot of happy hormones. We have what we call the SSRI, selective serotonin reuptake inhibitors. It's a
Hey, really
and
can't
so
take
what
that.
it okay, let's break it down. What it does is, the brain is balanced. We
Right.
have happy hormones and then we have literally sad hormones. We
Right.
have parts of the brain, chemicals in the brain that excites the brain, and chemicals in the brain that make you sober. So that if you enter a boardroom and you are supposed to discuss business meetings, it's not there that you start jumping, start dancing. But then if you go to a party and they are playing some good high life music,
Yes.
then you start to dance because there's a part of your brain releases a happy hormone.
Yeah.
You see your loved one, you see your daughter, you
Yeah.
become happy. And so what the drugs do is increase the amount of the happy hormones in the brain so that you can feel a bit euphoric,
Right.
a bit more happy. And usually we don't intend for these to be permanent. We usually want to give for any period between 3 months to 6 months. This brings another problem because stigmatization has created a situation whereby when you are given these tablets, I say, "Hey, WW, why are you giving me these pills?" It's for
Yes.
people who have mental problems. I don't
Yes.
have any mental problem. I,
Yes.
I rebuke that. He says that I don't have any mental problem. Don't give
Right.
me any drugs. But to be honest, sometimes it gets to that level. And
It
as I
does.
said, once things get better,
Yeah.
if the social factors or the triggers are taken care of, whether you had a major discussion to solve the marital problems, or if unfortunately divorce happened and you feel better about it, then we are in a position to take away the medications that sort of make you happy. And another thing, sometimes depression can, some people even just watch a movie and that just puts them off for like the next 2 weeks, 3 weeks. And in countries like the UK, your weather alone is depressing. You know, a lack of sunshine, all the place being gray. It also contributes because we have something we call seasonal, seasonal affective disorder. And that occurs in the winter because there's no sunshine. So to be honest, when you're talking about depression, then you realize that you are moving away from tablets, pills, and blood tests into human social life. And you realize depression is it's not just the science of it. It's not like malaria. It's not like diabetes. It's actually something to do with cognition and the way you appraise yourself as a human being. Yeah.
So some people might, like you said, might be depressed, but then they might cover it up with different things, like
yes,
depressed. And I remember when I was doing my A levels, I used to have friends, and when they were doing biochemistry then, and one of my friends, whenever she's down or she feels like the assignments or whatever we do is too much for her, she go and smoke.
Yeah.
So I sat down and I was like, okay, why do you smoke? He said, oh, when I'm down, when the things are too much. I said, listen, after you finish smoking, is that probably going to be solved? And she was like, no. And I said, you are rather causing damage to yourself. You're doing more harm to yourself than helping yourself, because the smoking is not going to change anything. The best way is for you to find a way to deal with that situation, or have a way that you can do your assignments, not smoking and causing damage to your heart and your lungs and causing worse things. And that's what people do. Or if I'm depressed or I'm down, I'm going to drink alcohol and I'll be fine. Does that help?
Princess is complex.
Right.
And this brings to mind, I'm very happy you brought this up because I may not have remembered to bring it up. Right. What we call coping mechanisms.
Okay.
In life, this is stress. Mm-hmm. And then this is the coping mechanism. So you have a race between your stress. So if stress is let's see, like TV volume. Right. If your stress is at TV volume 5, your coping mechanism should be at least 5 or above. Okay. And that is why religion to me is very important. If you give everything to God, sometimes it helps. I've given all to God. It helps you clear your mind. That's one thing. Another thing too is to develop things that would help you to cope, so that you don't resort to all these things. I remember when I attended Prempeh College, obviously the best school in Ghana, but we'll come to that later. So then when we were in Prempeh College, we had the same problem. You go to school, you get stressed and depressed. You have 2 options. Option number 1, depression. You are not feeling happy. Anger is energy, and that energy needs to be dissipated. So would you rather use that to go on a jog? Do you want to use that to go and exercise? Do you want that to go to use that energy, that disappointment to go and punch a bag in the gym or do some push-ups? Would you rather do that, or you rather grab a cigarette? You see, all of them are coping mechanisms. And another thing that I have come to terms with is the fact that all these things, no one is born to knowing how to smoke. Your friends, they teach you, they pass it to you. It contains nicotine. Cigarette is a drug. Cannabis is a drug. All these things are drugs. Alcohol is also a sedative. It's a drug. So then you get used to it. And as you said, they don't solve the problems. So another thing you need to do is to get proper coping mechanisms. If you have a good friend, that is a good way. And this is also another problem. A lady is depressed. She's having a bad marriage. She has a male friend who takes advantage of her. Not that kind of relationship. But if you have a friend, a lady friend, or even a male friend who is responsible, who you can share your problems with, who gives you ideas, and even tune into programs like what you are discussing, these help a lot, because this would empower you with the knowledge you need to be able to decipher some of these things. And so, for every stress you face in life, you need a coping mechanism. You need to cope. Cope. Like me in this UK, here you don't have your parents, you don't have anyone around. This is one of the coping mechanisms for me. I have a lot of knowledge, so if Princess Roy calls me, we can share knowledge and then we can help people. I'm coping. I'm helping my mental health, and we are reaching out to people. So it's a productive thing to do. So anytime you feel mentally stressed and you're feeling depressed, take time, get a pen and paper, write down what is happening. First of all, identify the trigger. What is the problem? Deal with the trigger. And if you need to cope, if it's that is your workmates, you are being abused at work or you're being abused by your husband or your partner, do something about it. Get help. Learn how to cope. It's part of being an adult. Don't run into all sorts of habits that would be deleterious for you. We've seen in the media these days people with bipolar. You see some of the things they do when they become manic. It causes all sorts of problems. So we should try and cope better. We should try and it's easier said than done, but it's something that we should be able to look at closely.
Absolutely. Because the way you fight for things, the way you want to do things, it's the same thing. This is very important. If depression is not handled, immediately it can get out of hands. Like you said, some people can be suicidal, some people are dying, kill themselves, because of this. So if they immediately you find the solution, the best for you is saving life. You save your own life, and if you ask someone that you feel or you sense it immediately, help that person. So, and lady was talking about the son. She's got a daughter, right, who's a teenage, and according to because I've worked with few youth before, and she made it clear she was suicidal. She wanted to kill herself. She was going through all this emotional thing as a teenage. So does teenagers also go through depression? Does it that they also go through that?
A lot.
Right.
A lot. And you see, the thing about
Why
depression,
a teenager will go through depression?
a lot, it happens. It happens. And that is around the same time that they learn all these bad habits.
Right.
That is when they learn how to use cannabis. That is when they learn how to smoke. That is, I don't have anything against tattoos or anything, to be honest, but that is when they start to do things because they need to express themselves and they are trying to look for some sort of happiness in a very difficult situation. And the problem we have in the Ghanaian society is the fact that oh, stop that thing. What small boy like you? Why are you feeling this way? But we've forgotten that times have changed. We have a lot of that's another thing that we don't realize. The way you and I were brought up in early 90s, we're sitting down watching Mami Dokuno, watching by the fireside and all of that. It has changed. Now the teenagers have Twitter. The teenagers have WhatsApp groups. The teenagers get invited to parties. And the teenagers get picked on. In the UK, the biggest problem is bullying and sometimes even racial discrimination. But in the context of Ghana, you would hear things like, Abba is the cool girl in school. She had a party. She did not invite me. Why did she not invite me? Because she thinks I'm not a cool person. All these feed into their psyche. And that is a point where they are having a lot of emotional development. The ladies are having their menarche, and the gentlemen are also becoming taller and bigger and getting test. So it's a complex time. So usually, as a parent, I think it will be a difficult because you need to balance justice and mercy. You are strict on them, but once in a while, when you look into their eyes and you tell that they are disturbed, have a seat with them and empower them. Let them know that what you're going through is normal, you're not a bad person, and get a feel of what's happening in their lives because usually it's just a cry for attention and then they'll be okay. If not, if you leave them, then they learn the bad habits.
That's it. Influence, isn't it? Because I support here and I know how it is, how easy they get influence. And all this nicotine and stuff and all that. I did a research on this during my A level environment. I realized that the chemicals that is in a cigarette alone. And I sit down like and ask myself, how possible do a human being sat down, put all these chemicals together for a human being to smoke it and to die out of that?
The thing
Honestly,
is, you see, there is a concept, a philosophical concept in life called hedonism. And hedonism has to do with the fact that it's a school of thought that says that man will do anything to be happy.
right.
That is the concept of, now we have things like YOLO, you only live once and all. I don't agree with those statements at
Of
all,
course.
because these statements give you a bit of the latitude to engage in certain things that are not particularly good for you yourself,
Yeah.
you know. And so the nicotine is the drug. It gives you a bit of euphoria, but cost and benefits.
Yeah.
If you think that euphoria is good for you, fine. But then what cost is it having to your health?
I
Would
see.
you? Because a lot of people you meet at age 80, when they are breathless on oxygen, you ask them, they say,
Yeah.
if I had known, I would never
I,
have smoked.
this is what I always tell people. I tell
Ev-
people,
I have not seen any person who has
honestly,
regretted. They
honestly,
always say it. So
I did some of my
research.
posts in the community, and you
Yeah,
see older people now that they
yeah,
are dependent on oxygen and they can't even
yeah,
go up because of oxygen. And I'm like, why do you put yourself through all this? Why should you? I have Afia back on the show. Welcome back, darling. So you are in Ghana, and I think this is it yellow? Is it yellow or whatever they talk about? Like you so Afia, what do you think about that kind of that what the boys are saying or the young guys are saying that you live once? What's your advice that you give to them?
I don't know what they were supposed to do, but since the ghetto is YOLO, they said it's only one. So if they leave one, I don't know what I actually said them because
Yeah,
there's two things that who want who are they. I don't
right.
know the ones they are living. Like, I
Yeah,
just like doctor was saying, I just
right. Right. It's so sad, but then I think our youth also need more of education with this kind of things.
yeah,
Because life is precious, and for you to think that you live once, no, you don't live once. After death, there's something there for you to meet, and so they should know that and be ready for that. Because yeah, like I always say that our body is just a body that we live in, but our soul is what is we. So after your body is gone, your soul is what is going to encounter the rest of whatever it is out there. So you don't live once and that you have to die once. Life is precious. You have to deal with it. If a young guy watching me today, forget about that thing that you talk about, YOLO or whatever. I don't even want to mention it. It is not doesn't make sense, right? Life is precious. Enjoy your life to the fullness because God what God has given to you. Okay. So I have other persons saying that. He said, I became depressed after I had my first child. And I think that's what we talk about postpartum
postpartum depression.
depression. So, Priscilla, said you have your baby, that's when you realize that you were, going through depression. And someone is saying here that she realized that she had depression after she had her baby. So, what kind of advice are you going to give to this woman here who's also going through? She just realized that she's got post. I think that's post antenatal depression. Obviously, that's it. So, how can she handle this? How did you handle your situation to help this woman? What advice do you want to give? Hello, Efia. I think we listen here.
Yeah.
Priscilla, can you hear me?
no.
You can't hear me. Okay. So
Yes,
I
I
was
can hear
saying that.
anything.
Okay. Can you hear me now? Is it better?
Yeah, I can hear you small.
Oh, okay. Is it better now?
Yes.
All right. So I'm talking about a lady just sent me a message and she said, Princess, I just realized that I'm going through depression after I had my baby. And like you said, you also realize it after you have a baby. So I'm just asking, what kind of advice would you give to this lady? How can she also handle what she's going through?
Okay. If the husband is abusing her in a way, I think she should report it to her family. She can
Right,
move to her mother's house for some time.
right.
I think she should move to her family for some time. When she get over it, then she comes back. But she should pray to God though.
And also pray to God. That's what he's saying.
Yeah, she should pray
Also
more.
pray to God. But the thing is, sometimes that's that change. Because if, for instance, after having the baby
Yes.
and the depression is coming from the other partner, and she goes and come back, is that going to make a difference? What
Yeah.
about the partner? If we don't deal with the
I'm
partner,
on please.
if he comes back, obviously it's going to be the same thing, isn't it?
Is
The
that's too
volume is
okay?
very down, so I can't even hear anything.
Okay. Is it better now? Is it better now? Can you hear me now, Priscilla? Okay, doctor, can you help us with this?
Yeah. So back to
Yeah, the volume is very down, princess.
So can you hear me now? Is it better?
I can hardly hear you, please.
Okay. I think it's coming from your side because doctor is able to hear me clearly.
clearly, yeah, we have to.
You can say somewhere that you can get more connection. I understand the situation, so it's okay. I understand the network problems and stuff. So
The volume is down.
can you hear me now?
I can hardly hear you.
Okay. Okay. So doctor, can you help us with that?
Yeah. So what I was about to say is the fact that the thing about illnesses is
The volume
you
is
have to,
very down. I can hardly hear you.
Okay.
yeah, you would want to look at every sickness or every illness you hear about,
Yeah.
break it down into the biopsychosocial approach using the biology, the psychology, and the social aspects.
That's it. Yeah.
So what is the biology? Anytime a woman gives birth, there is a release of a hormone called prolactin.
Right.
Prolactin is the lactating hormone. That is what gives you the breast
Yep.
milk.
Right.
But the thing about prolactin is, even though it's good, it gives you breast milk. The bad thing about prolactin is it makes you sad.
Right.
That's why you see pregnant women, they give birth, say, oh, we drink one, and then they start crying.
Right.
Yeah, because they are filled with emotion. That's the
Right.
biology. So it can be her fifth child, it can be her fourth child,
Yeah.
but still she would feel that way because of the biology.
Yeah.
So that's the biology. Then what's the psychology to it? The psychology to it is closely linked to the biology. The
Right.
psychological aspects are, how did she conceive this child? Was it, I'm trying to choose my words carefully, was it a planned pregnancy? Or
Right.
was it one of those, YOLO, link
Yeah.
up, link up when nobody was looking? Say, look, lock the door. They are not coming, they are coming, that kind of thing. So, was it planned? If it was
Right.
planned, maybe you have a husband, you're happy, everything. If it wasn't planned, maybe you had pressure to do all this termination and you did not go by it.
Right.
So then you feel this burden within you. That's the psychology. And then what's the social aspect? Who is with you?
Yeah.
Childbirth is very stressful. If you have
Yes.
to go and lie down in the hospital without anyone bringing you light soup, we live in a very communal society. I
Right.
mean, I don't want to use UK standards. Let's think about Ghana. When you give birth, that's a time for family to come around you, different
Yeah.
types of soup, different types of food, different types of, the love. It
That's really
helps.
nice, isn't it? Because
Exactly.
we're not getting here. We don't
Exactly.
get
You will not get all of that here because everybody's busy working. So that's the biopsychosocial approach. So, and another thing about medical issues is what is normal and what is abnormal.
that's it.
For
Yeah,
example,
me here.
pregnancy
Poor
normal.
network. Poor network.
Can you hear us now?
What? So then, what is normal and what is abnormal?
Yeah.
What is normal is that for the first 2 weeks after you give birth, you'll be sad. Normal.
Yeah.
We
Okay.
give you that grace period.
Yeah.
What is abnormal? After the 2 weeks, you are still sad.
Right.
6 weeks later, you are still sad. 8 weeks later, you want to strangle your child. Your child is crying. You raise the baby up. What do you want from me? What do you want from me? Who has sent you? Are you a devil? You know, we have something called the shaking baby syndrome.
Right.
People shake their babies until they get hemorrhage in the brain and they go to yeah. Or when someone will tell you that take this boy away, take this devil away, take him away. And so you want to know the normal period is 2 weeks.
Yeah.
After 2 weeks, those are the baby blues. After
Yes.
2 weeks to 6 weeks, we have postpartum depression.
Right.
After 6 weeks going to 3 months, then we are entering psychosis.
Wow.
What is the difference between depression and psychosis? Psychosis is when you begin to hear things, you begin to see things. So you
Right.
begin to hear something telling you that this boy is causing you stress. Look at how he has made your body deformed. Take care of him, take care of him. Nobody's watching. Psychosis. Then it's a big problem. So
That is not
we
a
have
demonic
from
thing. That's not
that's a
demonic.
different level.
Okay.
So all of these happen
This
after
is
pregnancy.
very, very important because most people will say that the baby, the devil, or maybe the demon is speaking to me or whatever. This has got nothing to do with demonic or spiritual or anything.
No.
Take much note of this because it's serious, honestly.
So get people by you. You know, we've heard of that old story that then the woman slept in the night and lay down on the baby. These things do happen. So when you give birth, you are feeling a bit this way, starting with the blues to the depression. Get help. Talk to your doctor. Say, I'm not feeling well about this. You ask you how long. Is it 2 weeks? And you tell you, oh, it's normal, it will go. But if it's there 3 months, 4 months, no, we need to
Yeah.
do something. We may even need to give you some medication or look for social help.
So men that are watching, it's the Pinky Room Show with Princess Roy. Our time is not spent, so we're not gonna spend more time here. If you watch it, if you see this kind of signs from your wife, because I want the men to understand. Sometimes some men wouldn't understand, and then it become a problem in the marriage, it become a problem in the relationship. If you see a wife going through this, it's not because she's going through anything or she's getting what do you call it, mad or she's being witchcraft or whatever it is. She might be going through a depression, which is getting out of hand. So you need to immediately do something to help her. Don't leave her alone in that situation. She will need you because if you help her, you're helping your baby, you are helping the family, and you are helping yourself as well. Can Priscilla hear me now? Priscilla, can you hear me? Is it better now? Can you hear me now? Okay. So I think a few ones that we just because I've got other people also send their um, comments and stuff which we want to go through it. Um, yeah, so I've said that. Said I put on weight and weight. Okay, so someone also said that after having a baby, she put on weight, and because of that, she's lost her self confidence and she feel depressed. She's now overweight. She wasn't like that because of baby. Now she's overweight. I think because of depression, she's eating too much and all that. So having put on weight now has made her more depressed. So in
Yes,
case of put on weight, what can she do to get better for herself?
good. You see, the thing about in this situation, first of all, you have to know that in order to carry any pregnancy, you need to put on weight. That's the fundamental thing. You see, I have noticed that what my medical practice has taught me is that for every situation, there's a cause.
Yeah.
So if you want to approach anything scientifically, take a pen and paper and write down what is the cause and break it down. When you break it down, things make sense to you. It's not your fault that you gained weight.
Let's see.
That's why we say things like Nehua Dane and all of that in Chi, because obviously you need to gain weight to sustain the life that you are bringing to the world.
Now, that's
So
true.
then you have given birth. That is the first problem. The second problem is the thing that is helping you produce milk is also making you sad. Problem number 2. Problem number 3, your husband is out there doing side chick.
Oh, my days.
I'm sorry if I said it.
We suffer.
You
Why
don't.
people created as this way? This is too
Problem
much
number 3.
pressure. It's too
Problem
much
number 3.
pressure.
You don't have a very supportive husband. Maybe or maybe not. So you
Right.
realize that you find yourself in what they call the vicious cycle.
Mm.
You know, sometimes you get into a problem and the problem itself is like a circle.
Yes.
You are just going round because when you are
And
solving one problem, then the other comes in. Then you exactly. So what she can do, first of all, she should sit down and understand. Is it time to have a discussion with the husband?
right.
If he's very reasonable, he's very supportive, talk to him. Say that okay, this is what I'm going through.
Yeah.
Secondly, what is the plan? So
Yeah.
now we have the baby. Am I able to do any dietary modifications? Am I able to do any workouts? Are there any things that I can do that can help me to improve my self-image? And of course, the way you look, your facial features, and your way your body is built feed directly into your psychology. That is why people who are macho or they are well built, you see the way they walk. It's just because they feel like they've invested so much in their body that they feel comfortable. Some don't even have money, but you see them walking around as if everything is fine. So she should get a plan. She should give herself time. Even the likes of Victoria Beckham and Beyonce and all of them. Is it because those times they don't take pictures? They don't take pictures, so you don't know how they have become.
Know what they've gone through. That's the thing. Social
You see
media,
that they'll be
social
hiding.
feeding
Yes.
us, making us feel
Thank-
that we are worthless.
No, they hide. They hide for 3, 4 months. You don't see her. Then all of a sudden, boom, she's back.
That's
What
it.
was she doing? The 3, 4 months, she was getting back in shape.
Right. Very
So
true.
exactly. So it will happen. The Victoria Beckham and all the people you can mention,
Mhm.
they got back in shape and it's possible. So break down the problem, understand what is happening.
That's it.
Understanding is like light. In all your gettings, get wisdom, get knowledge, get understanding. She should understand what's going on and work towards it. She'll be fine.
Thank you so much. If you're watching me, the lady who sent the message, I know you're watching me. Take note of this. If you can
Yeah.
go back to my YouTube channel and watch this again. If you just joined us, I see people now joining and send their comments. If you just join us, you miss from the beginning. It will be on my YouTube channel. You can go there and watch. It's also on my Facebook page. We have it also on Aberdeen TV, streaming live on YouTube, also on Facebook. You can also go there and watch. Aberdeen TV is in Nigeria, and we have Lively TV also in the UK, streaming on Facebook and on YouTube as well. So you can watch it, go back and listen to all the advice the doctors has given, Dr. Faisal has given to us. I'm just going to read this last one and then I'll go through the comments because I've seen someone saying that she's going through depressed and all that. And so we can also answer her question. Someone also said that I am a man. For some time now, I can't sleep well, neither can I eat well. This started after I lost my job. It says, is this a sign of depression? He says he's a man who lost his job and now he can't sleep, he can't eat well. Is
Yep.
this a sign of depression? He wants to know.
Absolutely.
Right,
Absolutely. Because depression, what are the criteria? You need a trigger.
right.
It may or may not be there. Some people are depressed for no reason.
No
But
reason.
most of us are depressed because of something. So the trigger is the loss of the job. The symptoms are he doesn't eat well and he doesn't sleep well. So this can be a case of mild depression.
Depression.
And
So,
mild depression is most of us go through it. Mild depression. You just get a good
that
talking
you
to.
want to
You are fine.
start something before it gets out of hand.
Exactly. Because if you don't take care of it when it's mild, it gets to moderate and it goes to severe.
Yeah. So yeah, if you're watching, brother, please begin to have something towards it. Work towards it before it becomes too late. Okay. So the last one is that a man says that my wife left me with my kids. I'm now depressed and on medication. I want to stop taking the tablets. How can I do that? So he's depressed. He's now on medication because the wife left him with the children, and now he's on medication. And he wants. I wonder what he did before the wife left him.
And I'm also going to ask: is he texting from the UK or is he in Ghana? This sounds very much like something that can happen in the UK. I know I'm being a bit controversial, but for our Ghanaian viewers, what
Yeah,
happens is if you have marital problems,
yeah,
depending on how things work out, um, well, it's controversial, but the opposite can also happen. Your wife can actually leave you,
yes,
actually with the kids, or take the kids away.
yeah,
And that tends to happen more in the Western world than in our local world, because in the Western world, the women are also very empowered, and the laws tend to favor women more than in back home.
yeah.
So that being said, this is might be a very bad situation he's in, and obviously we can't take sides because we don't have the full story.
That's it.
I remember once I had a patient in the hospital who developed ulcer
Right.
because he was telling me that he's a Ghanaian lawyer, and he was telling me how he brought his wife from Ghana in the 80s, and they were living together,
Yeah.
and now the wife married someone from the UK here and has left him and taken half of his property. Also, I couldn't take sides because I didn't have the full story. I
That's it.
mean,
Yeah.
one-sided story. But then in such a situation, you can be very devastated.
Yeah. True.
In the Western world, it does happen. If you go through a bad divorce,
Yeah.
your wife can divorce you just as much as you can divorce her. That's
That's
the
it.
way things work in the Western world that I'm also learning about. And so, as they would say, Obi mine. So yeah, exactly. So it sounds to be like a UK story, but
That it is.
um, I wouldn't be surprised. So, in such a scenario, as I keep saying, let's first of all unpack the problem. Let's understand what the trigger is. I'm not too concerned about the medications because I'm sure it's his GP who put him on the medications because at the time it was the best thing to do. He
Yeah.
can still take the medications. It's maybe a very difficult time. We don't know what he did for the wife to leave, or we don't know whether the wife is right or whether he's right. It's hard to tell. But he should take the medications and
Yeah.
see how whether the legal system or the social system can help him. It's very difficult. For all you know, he even has a there's a restraining order against him. He can't talk to his wife. He can't. It's difficult. It gets very hectic sometimes. But we still need to get more details, and he should take his medications for now, for the sake of his children, so
Right.
that he doesn't get too down. Yeah.
Okay, so if you just tune in, I see people coming, still coming in. Our time is fast, but I don't want to take. You can see our doctor; he's still in his scrub uniform because he just came from the hospital working, and I have to wrap him here on our show. So, and I'm so grateful for your time and your commitment and everything. I'm so grateful. Thank you so much. I'm not going to take much of your time because we're already taking as much as we want, and we're really enjoying your education and
Yeah.
everything, all the information you're giving to us. To be honest, I've learned a lot, and I believe my audience who are watching have learned a lot. Because I see them coming, they're still coming, but honestly, we can't stay here till whenever. We have to say bye at some point. If you just tune in, it's the Pinky Room Show with Princess Roy. I've got Dr. Faisal on the show. He's teaching us a lot about depression, the signs and symptoms, how we can handle it, the triggers, and the thing that we should handle before it gets out of hand. Please subscribe to the YouTube channel and then go back and watch again. These are the things that we need to hear. These are the things that we need to spend our times learning because this with depression it can be very dangerous if we don't handle it immediately. That's why we took our time to do this to get a specialist. He is a senior medical doctor. On top of it, he is. Uh, you said you are.
Deputy Superintendent, Ghana Police Service.
I don't know what to say because this is too much. You are a lifesaver in a whole life. So yeah, please watch it again and again and again and learn a lot from it. I've got a comment from here, so I'm going to read a comment, and I think we've got some few questions that maybe we need to answer. So we've got Karen here. Karen saying that I hear, okay, and Nathaniel saying nice, and Andrew saying that welcome everyone. And I've got Abigail saying thumbs up, And then Benny Adu say that, good to be here. I am blessed. Thank you. And then I've got Vida who said that I hope our internet won't disappoint us today. Obviously, we've lost Afia Prinscilla on the show because of the technical issues or internet issues, I think, in Ghana, right? So, yes. So we are here live to support. Thank you, darling. And I've got someone also saying it's not about fixing road, it's all about discipline. So we talked from the beginning. We said about our what is going on segment. We talk about the road and the accidents and all that. So someone is saying that it is not about fixing the road. It is all about discipline. That's what he thinks. Okay. And I've got someone also saying, Kutua also say that Beku Boatin won't throw the rubbish on the streets in the UK because the system works. If only people will be fined for these behaviors, the problem of littering will be stopped. Which is true, isn't it? If they put the measures there, obviously. And then I've got Vita saying, Princess Roy might know this. I went into depression so badly, I almost took my life. Wow. If I wasn't closely monitored, I didn't know this until all the doctors started phoning, etc., etc. Right. Okay. Right. So, so doctor, what do you want to say about this?
Well, what I want to say about this is let's learn how to cope.
Yeah.
First of all, let's be each other's keeper. If you find out someone is depressed, point it out to them. Sometimes they don't even know.
No.
And one thing I failed to mention is the fact that sometimes to compensate for how sad you are, you become hyper. It happens a lot in movies. I don't know if you heard of this
Yeah.
this actor called Robin Williams.
Yes.
He was a comedian, always happy, shouting. You see all this Jim Carrey and in our local parlance, Lil Wayne and all these guys that I don't know what is the word misbehave, but who do things for us to laugh. Deep down, a lot of them are depressed.
True.
But they need to compensate for it, so then they do the opposite. So if you see someone, you say, Charlie, of late you are too happy, are we okay? He might be depressed, not only being too sad. So let's be each other's keeper.
Right.
And let's also demystify it. If someone has opened up to you that they are depressed,
Yeah.
it's not the time to go and tell the whole world that, Chrissy said this, Chrissy said that. No. Because usually they will look out for a friend. And if you are that friend, let them go to the hospital. When you get to the hospital and the doctor wants to give medications, just take it. It's not forever. It's not forever. Take it until you settle down and things are okay. And then you can go off safely. Because these things are real. We always say, oh, this is a brofuya, it's things like, it's not true. It happens. And so we should all be on the lookout. And sensitization is important. We should destigmatize it. It's not sunsum it's not spiritual whatever causation we can deal with in the hospital.
The medical attention.
Exactly.
You saying this, and there's something I've monitored on social media, right? You see some of our women, which we're going to talk about this very, very severe, because many of them that comes on them and show off, some of them that goes on mute and all that. Some of them, there's something that is going on behind that they use in social media just to cover it up. That's where they think they get their excitement from, because that's where people will be saying things and stuff and all that. And honestly, it's very sad.
Exactly.
Social media presence and whatever the yoga or whatever it is, they go back home and they are dying in. And then, like you said, there's one comedian in Ghana. I don't know if Funny Face or something of that sort. I don't know if you heard.
Yeah, Funny Face.
Look at this guy who is so funny and fun. He's all over. Every time video you watch him, you feel happy yourself because the things that he say. But behind closed door, he was going through things like you mentioned.
Seriously depressed. He was seriously depressed. He was even suicidal at a point. This is a typical example.
Yeah.
And the sad part is sometimes we watch them just go. It happened in the UK with Amy Winehouse. Same way. Instead of helping her, we criticized her.
Yeah.
Found out that she passed away. So these things really do. We should help.
We Austin, the same thing.
Same thing with Whitney. She was crying for help, and all we did was criticize her
Right. So
because
guys,
it's easy to criticize. It's it's that's what bad news is what we are drawn to, and we know how to criticize. But
it's very sad.
sometimes we should lend a helping hand.
Wow. Right. Guys, honestly, it's getting more interesting here, and if you don't take it, we're not gonna go. Okay, so our last comment is that I love this. This is from Rose Ogusu. He said, "I love this discussion. God bless you all." I have a lot of comments on my WhatsApp, but because of time, we're gonna leave it here. Doctor is so tired. He's taking more of his time. I bet he hasn't even having his dinner yet, and just dragging.
No.
But that's for that. We lost Afia. Probably maybe we'll have him back. We'll have Afia back on the show. And also, Doctor, we're going to have our men's side of you as well. This is
Okay.
for the men. We'll have the men come on the show and spread themselves. And we'll need you also to come back with us and then help them, those who need the help, the men as well. Because it's not only women who go through depression. I think that the men one might be worse too. Because men doesn't like visiting the hospital, isn't it?
Of course. And then we also have Berman and Sue.
Men doesn't like going to the
Men
hospital.
men don't cry. Men don't like going to hospital.
They don't.
Yeah. So ours is actually worse. And you know something? Suicide rates.
Right.
Women attempt more suicides than men, but men are more successful in suicides than women.
Right.
Simple facts. So if a man decides to take his life, he will die. But a woman may do it just for the attention, and maybe she'll tie the rope and then open the door, write a note, people come in and she'll stop. But if a man decides to kill himself, he will lock the door and swallow the keys.
And then do it. Oh wow.
So that's what makes suicide more common in men.
Yes.
I had my own police senior colleague who taught me in the police academy. He just woke up and shot himself and wrote a letter, and that was it. So it's a big problem in men as well. Yeah.
Yes. Okay. So we need more time to talk about it. Like I said, we'll have the men also to come and share their views and discuss about it. So, Doctor, I'm going to say bye to you. Thank you so much for your time. It's been wonderful having you on the show. And honestly, I've learned a lot, and I believe that my audience too have learned a lot. And he's coming back on the show. You can see the knowledge, you can see the skills, everything that he's got. We need more of him, Doctor. Is there anywhere we can find you? Is there anything that you do? You have any social media or something if somebody needs help or any advice? Where can we get you, please?
Okay, so yes, I'm easily accessible these days. As I mentioned, I'm a trainee dermatologist at the Peterborough City Hospital. But apart from that, you can have you seen my name, Faisal Ayimbila? It's very unique. If you type on Facebook, I'll be
Okay.
there. You'll get it. I'm
Yeah.
also on Instagram as well. And then you already know my WhatsApp number. So if a few friends want to get in touch, that is
Want to
also
get in touch with me? Yes.
that is possible for God and country.
Yes, for all the country, for Ghana, wherever you are, he will be there to help. We need this. Don't wait until it gets out of your hand. That's what I would say. Last. Is there any last advice they want to give? Any last?
Yeah. So well, first of all, thanks for having me over. And this is very good service to our country. It's also good service to Ghanaians all over the world. And so let's stay safe. Depression is real. Let's get help. Let's guard our mental health. God is king. Let's live life. It shall be well.
Thank you so much. Thank you so much. So we're gonna say bye to our doctor now. This is the people room for Princess Roy. Please go subscribe to our YouTube channel. Help share this to your friends, your family, so that they will also learn from what we've done today. And also watch out for our next episode that's coming on next month and the topic that we're bringing to you. Please subscribe and watch it again. It's on YouTube. Watch it on Library TV, on Aberdeen TV, and Princess Roy YouTube channel. Thank you so much for playing us. Bye for now, Doctor. God bless you.
Bye. Thank you so much. Cheers.
Okay, guys. So this is where we're going to end with the show. So this is our June episode, the Pinky Room Show with Princess Roy. I'm live in the Library TV today, and as you can see, I'm glamorous. Today, my makeup is by Desley Beauty, right? And also to my partners, Lively TV, UK, and also Aberdeen TV, Nigeria. And my sponsors, Tekis Yogurt, African Connect, and Roy Shito. Thank you so much for everything. Really appreciate it. So I'm gonna say bye to you. I know people are still tuning in. We are live. Also, you can watch us again. This is on our YouTube channel, Princess Roy YouTube channel. Just go click the Pinky Room Show, all right, or Princess Roy, and you can have this show and you can watch it. Very educative, right? We empower ourselves. We have specialists, we have doctors, we have professionals who come on the show to help us. All the help that we need. If you need anything, our contact details is on the screen. Don't hesitate, right, to contact us. We can help you spiritually. We can help you psychologically. Your health, everything that you need, we are here to give to you. Just contact us or email us. All the details are on the screen, right? And thank you so much, my audience, for tuning in today with me, Princess Roy, in the Pinky Room Show. All right. Don't forget to subscribe, hit the subscribe button, right? So anytime we come live, you will have an alert and you can also tune in and enjoy this wonderful show. It's bye from me, Princess Roy, in the Pinky